Hi, I'm Dan Sosnoski, Editor-in-Chief of Chiropractic Economics, and we're here at Parker Seminars, Las Vegas 2018. I'm joined by Dr. Sherry McAllister, Executive Vice President of the Foundation for Chiropractic Progress. Dr. McAllister, thank you for joining us.
Thanks for having me.
All right. Well, you know, I'd say the number one initiative of the Foundation is education. And in the programs that you've been running recently, what kind of response are you getting?
This is a very exciting time because right now we're positioned very beautifully to look at a crisis. The opioid crisis is an opportunity for us to showcase us being a first-line, cost-effective, safer approach to healthcare.
For sure.
And a lot of times when we start to develop that conversation, people start wondering, well, I don't really know a lot about chiropractic. Can you tell me a little bit about it?
Right.
Or we get questions about what is the efficacy?
Right.
And who's supporting chiropractic? And we've had more news in the last 2 years than we've ever had before with ACP guidelines, with the Institute of Medicine, with the Joint Commission.
Yes.
We've had Harvard Medical News, and it becomes very exciting when you see that kind of energy looking towards a non-opioid solution to people that are in chronic pain. And we have 100 million people in chronic pain, and they're looking for help.
Right. Well, in years past, chiropractic was kind of on the outskirts, and a lot of people weren't sure what it was. They'd never even heard of it at all. That's changing, and we're seeing chiropractic in the news frequently, and more it's in a very positive light and making a positive difference. And the foundation is, I think, can be credited with a lot of that publicity.
I appreciate hearing you say that, and I think in the recent months we've been able to have our articles posted in America's Health Insurance Plans. We've been in Shape magazine,
Sure.
where we've not been before. Even today we had a radio pickup on 5 of the greatest things in what we're looking at on what's called 5 Friday, where we took in 5 of our key points. We had athletics being focused on, we had seniors being focused on, our veterans, we had the opioid crisis, and really just how the consumer can relate to chiropractic. And we've been in the Observer just recently, so we've got a lot of exciting new media pickup that makes a difference. It makes a difference because consumers don't see chiropractic out there in the mainstream media on a regular basis. So when we do have, like today we put an article that showed influencers adopting chiropractic into their programs, and that in the Wall Street Journal is a half-page ad that makes a difference to those that are involved.
Very good. And for doctors who want to kind of seize the initiative and get the word out about chiropractic in their own communities, how are you assisting them in doing that?
I think one of the big keys is if you go onto our foundation site and you start to see we have brochures you can download into your own practice, just putting it up for your patients to see. We have press releases that you can easily customize and email to a media center. We've got advertorials that can easily be utilized in your newsletter, and we also have some great infographics that social media. It's with our accelerators. It's one click onto your Facebook. It's one click into your Twitter account. These are kind of making it very simple so that a doctor doesn't have to spend much time, because their time should be used teaching the patient. And when they're not in practice, they can teach the patient online, and that's a big part. Social media is playing a big part to that. But just getting out into the community, having a white paper that they can take with them.
Sure.
And exciting to have, we're adopting some PowerPoint presentations. So that's an easy way to inform your current patients and also new ones that are looking for pain relief or wellness care.
And having reviewed most of those materials myself, just in my work with the foundation, I can say that you're right. Those materials are made easy to access, they are easy to use, and yet they are sophisticated in design and they're extremely professional looking. So I could not praise them more. For its part, the foundation, which can be found online at f4cp.com, what are some of the kind of key initiatives that are going on right now and that you expect to launch in the near future?
Sure. We're getting creative. We know that our audience is also looking at opportunities to educate themselves. So coming out with ebooks so that patients that may not be thinking chiropractic are thinking, well, I have some of these symptoms, and using ebooks. We have a monthly roadmap that comes out, and it literally is your direction. You can give it to your front desk and say, look at this roadmap, and it works really synergistically because I send out a podcast. It's 2 minutes. You can listen to it on your way to work. That tells you what's going on that week. Each month is layered with a specific theme, like March right now, headaches. And we have lots of infographics that go with it. And what happens after a roadmap comes a Monday marketing memo. They'll be able to look at that and say, this is great, I've got all the things lined up and I can pick and choose whatever I like. We also have webinars that help you progress through and your continuing education, maybe shape up a little bit on what's going on in the headaches and what are some of the techniques that have been used. Along with that, we have a opportunity to increase your visibility in the neighborhood by a PowerPoint presentation that focuses more on what you'd like the consumers to do. So we've got a host of brand new ways for you to make it very simple and increase your visibility as well as the consumer's visibility in the education department.
So if a person joins the F4CP and helps support you, they certainly have no excuse to go, I don't know what to do, nobody's helping me, it's too hard to get. You make it absolutely
we
as
hope
easy
that
as possible.
it's just so simple for them to be able to adopt it into their practice. But I think one of the key points that I like to remind everybody is when you utilize our material, you're strengthening our national voice.
Absolutely.
And when we all are saying that we're a safer solution than opioids, that we're a first-line approach, we're cost-effective, patient satisfaction, they love us. And when we're saying those things over and over again, we're not confusing our consumers, and that's a really big benefit. So it goes back. When you support the foundation, you're supporting the profession, and that's a key as a nonprofit organization.
Well, those are powerful, consistent messages, and they're ones that needed to be put out into the community. So Dr. McAllister, thank you so much for the work that you do, and we look forward to keeping an eye on your work in the future.
Outstanding. Thanks for having me.
Thank you.